In this webinar, we shall learn what to feed, in other words, the sources of nutrition in low birth weight infants. We all know that breast milk is the ideal feed for all infants until 6 months of age. This applies to even low birth weight infants. So, all low birth weight infants should be fed only mother's milk, either by direct breastfeeding or as express breast milk. Because breast milk feeding is the key in care of low birth weight infants, we should know how to improve that. The important strategies to improve breast milk feeding include psychological and social support of mothers right from birth or admission. Admitting mothers in the same hospital, which is particularly important for outborn babies. Encouraging bedding in, whereby mothers and the babies are kept in the same bed, or visit to nursery. Promoting kangaroo mother care once the baby is stable. Facilitating mothers to express breast milk from the day of birth, and ensuring adequate nutrition and rest to the mothers. There is no role for drugs like metoclopramide in promoting breastfeeding. While breast milk is the ideal feed, it alone cannot meet the daily requirements of some nutrients, for example, iron in low birth weight infants. Therefore, all low birth weight infants who weigh between 1500 and 24,999 grams should be given daily supplements of iron and vitamin D. Iron has to be given in the dose of 2 milligram per kg per day, while vitamin D is to be given in the dose of 400 international units per day. Both iron and vitamin D should be started at 2 weeks of age and stopped at 1 year of age. In very low birth weight infants, in addition to iron and vitamin D, we must supplement multivitamins and calcium and phosphate also. Multivitamins are given in the dose of 0.3 ml per day from 2 weeks to 1 year of age. It is preferable to use the preparations containing zinc. Calcium and phosphate should be given in the dose of 120 to 140 milligram per kg of calcium and 60 to 90 milligram per kg of phosphate. They should be started when the baby reaches full enteral phase, and they should be stopped when the baby reaches 2 kg. Some very low birth weight babies may not gain weight adequately, that is 15 to 18 gram per kg per day of weight gain even after taking optimal amount of breast milk. These babies should be given fortified milk by adding human milk fortifiers to expressed breast milk. The fortifier is available in a powder form. It should be mixed in the concentration of 1 gram per 25 ml of breast milk. It has to be continued till the baby reaches 2 to 2.5 kg weight. Now, let us focus on feeding in special circumstances. Rarely, the mother's milk may not be available for a low birth weight baby. For example, the mother has died or is very sick. In that case, the alternatives in order of preference are expressed donor milk, infant formula and animal milk. While the preferred option is donor milk from healthy donors, it requires the services of human milk banking, which is not available in most parts of the country. Formula milk can be either in the form of standard term formula or special preterm formula. Animal milk is the least preferred option, particularly in preterm low birth weight infants. Babies born to HIV positive mothers should be given exclusive breastfeeds till 6 months of age. Top feeds, either formula or cow's milk, should be given only if the mother has died or has terminal illness, or the mother decides not to breastfeed despite adequate counseling by the healthcare providers. Even in this case, the AFOS criteria, that is acceptable, feasible, affordable, sustainable and safe, this AFOS criteria should be met before the baby is started on formula or animal milk. Remember, these babies should be either on exclusive breastfeeding or on exclusive top feeds. There is no role of mixed feeding in which we give some breast milk and some top feeds. Babies born to mothers with active pulmonary tuberculosis should be started on exclusive breastfeeding. There is no need to separate the mother and the baby unless the mother has multi-drug resistant TB or is very sick, in which case the baby can be given express breast milk. Thank you.